As a patient that's 38 weeks pregnant in the waiting room with a blood pressure of 165/90, get them to a room immediately. Why? The blood pressure isn't even that bad. It is for a pregnant patient.
So this is a video from a nurse on another platform, and I just want to break down some of the points in this video. The first is that, yes, a blood pressure of 165/90 in a pregnant individual, definitely elevated. Anytime you have a systolic blood pressure of greater than or equal to 160 and or a diastolic blood pressure of greater than or equal to 110, needs to be treated, repeated, and then treated.
I brought them back, blood pressure went up a little bit to 170/100, and they're saying they have a headache with slightly blurry vision. I'll go get another IV in the patient, you go tell the doc. That needs to be treated now before they start having seizures.
Now, the repeat blood pressure was 170/110, definitely needs some IV medication. If the IV is not readily accessible, we do or can give something oral, but preferably IV if we can get that IV in right away. Now, with the elevated blood pressure, headache, blurry vision, preeclampsia, if it walks like a duck and quacks like a duck, it's a duck. However, the reason why we treat severe ranging blood pressures in patients that we are tentatively diagnosing with preeclampsia is not to prevent seizures. Seizures and preeclampsia, which then makes it eclampsia, can occur at a much lower blood pressure than that. Just because the blood pressure is high doesn't mean that they're at a greater risk for seizures. It can happen at lower blood pressures. The reason why we treat severe ranging blood pressures is because we don't want the patient to stroke out. If that blood pressure keeps climbing, they can have a stroke. We don't want that. So it's to prevent stroke, not seizure.
Doc ordered hydralazine. What's the heart rate? For the baby or the mother? Good point. Remind the doc he needs to check the fetal heart tones, but what's the mother's heart rate? A little high at 115. See if the doc wants to give labetalol instead. With that heart rate, labetalol is usually the go-to to bring down the blood.
Okay, if a patient comes in at 38 weeks and you're concerned about preeclampsia, they should be on continuous external fetal monitoring, period. Not just checking with the fetal heart checking fetal heart tones with the Doppler. Now, the two agents that are typically given first line for IV intravenously are going to be labetalol or hydralazine, and it really doesn't matter which one you use. Some labor and delivery units have hydralazine first, some have labetalol first.
But why did the doctor order magnesium? It's not even low. Magnesium produces vasodilation and is a CNS depressant, so it also helps prevent seizures. Got it, but he ordered 5 grams of magnesium. Isn't that a lot? So anything between 4 and 6 grams is.
So the typical loading dose for magnesium, which we'll get into in just a second, is 4 to 6 grams. So you do a 4 to 6 gram load followed by a 2 gram maintenance infusion to prevent seizures in those who are preeclampsia with severe features. There, and where I work, but a lot of centers no longer do seizure prophylaxis with magnesium in those patients with preeclampsia without severe features. How magnesium sulfate actually prevents seizures is, we just don't know. If you pause to read this, it gives you some of the theories on how it works to prevent seizures in preeclampsia.
I got the patient seizing. I'll grab the Ativan, you call OR. We need an emergency C-section. That baby needs to.
Okay, now, the worst time to stat section anyone who is seizing, preeclampsia or not, is while they're having a seizure. Seizures during, or eclamptic seizures are not an indication for a stat cesarean delivery, ever. You stabilize the patient, treat the seizure, and you could still have and go for a vaginal delivery. I've done it many, many, many times, but you don't want to rush somebody to the OR when they're seizing. Absolutely not. While I appreciate the attempt on this account to educate on this topic, I think it's very important to make sure accurate information is given. And as you can see by how I kind of dissected this video, that there were some inaccuracies there. And because this video had a lot of views, I felt the need to make those clarifications and corrections.